My name is Aisha Abdulmumini and I'm from Nigeria. I've known Dr. Renu for over 9 years. I was diagnosed with hormonal imbalance. So after I got married, I have some challenges. I always have miscarriage.
I have known Aisha for around 9 to 10 years now. She came to me about 10 years back when she was unmarried and grossly overweight and had problems with her periods. And at that time, she was diagnosed with metabolic syndrome. Her blood pressure was also high and she was diagnosed to be borderline diabetic. So we gave her medications to regulate her periods and to bring down her hormones to a normal level. And after which she had regular periods, and one thing is good that she came to us and she was in regular follow-up. Even though she lived in Nigeria, she used to come down every 6 months or so. After that, when she got married, in her first pregnancy, she had IUD, an intrauterine fetal demise, at around 30 to 33 weeks, and that had quite a bad impact on her mentally, because she had conceived with a lot of difficulty. Then she came back to me and again she was having trouble conceiving. We gave her some medication to help her conceive. She conceived with ovulation induction, and then during that pregnancy she was in a regular follow-up with me, and we used to prescribe her medicines from teleconsult. And finally when she was around 34 weeks or so, she delivered in Nigeria the first baby by a cesarean, and that baby is all right with her. Again, she had 2 consecutive pregnancies after that, but she lost both of them because her PP in the pregnancy would shoot up very high, and the Doppler flows for the baby would get deranged, and that usually led to IUD at around 28 to 26 weeks. So after having lost 2 babies, again Aisha came to me last year because she couldn't come during the COVID time, and that was the time when she lost her babies. And this time she followed up. Initially she got pregnant, stayed here for some time, and then she went back. We put her on anti-hypertensives, we put her on low molecular weight heparin, and also her medication for diabetes, and then sent her back. And with I had also told her to come back around 26-27 weeks so that we could then monitor her closely and she could deliver here.
And she advised me to come to India after I'm pregnant. I was pregnant and I came to India for medication. After that, she asked me for a scan. I did a scan, and then they had to remove the baby at 30 weeks because there was a dialytic flow.
She complied with, but at around 30 weeks, again this time her Dopplers became very deranged and her blood pressure shot up, and we had to do an emergency section. But because of better NICU facilities and level 3 tertiary care nursery, her baby went to the NICU. It was about 1 kg, and but the baby did survive all odds, and she also went to the ICU, had to be managed for about 2-3 days in the ICU with very high blood pressure. But finally it came to a good ending, and she could take away her baby back to Nigeria now, and she's quite happy and contented and has now 2 children, and she's happy.
After they removed the baby was alive, all thanks to Dr. Renu and her team. Alhamdulillah, alhamdulillah.